I did a very long video on acne scarring that's about 35 minutes long. I don't think you're going to probably want to watch that unless you're incredibly serious about what I do. But I wanted to, I had a question that was posed on Facebook by a friend of mine that is also a patient. And it was about before and after I submitted where the patient had a really good, but not perfect yet, result with acne scar correction using mesotox or mesobotox treatments that I have really perfected. And she asked, a friend of hers had a treatment for acne scars using a Fraxel treatment and had really good results reportedly with like one round of the treatment, and was wondering why I didn't use Fraxel. So first of all, I own a Fraxel. I do use Fraxel. In fact, I use Fraxel every week. I used one yesterday. But I don't use Fraxel for acne scars. I think it's really, really problematic in so many respects and so limited in gain. In fact, the majority of my patients that I do for acne scars are actually a result of failures from Fraxel and from other types of resurfacing techniques, including more aggressive methodologies like dermabrasion, mechanical dermabrasion, not to be confused with microdermabrasion, actually sanding down the skin. And I love dermabrasion. I did dermabrasion this week as well. But I don't do it for acne scars in general, and I use that as a polishing method. So I'm going to try to keep this video short of not the 35 minutes, but to focus on some of the ideas. So these are concepts I've reiterated multiple times, but I want to encapsulate it in a more concise fashion. So when we look at our skin, when you really look at acne scarring, which is atrophic in nature, they're holes, and oftentimes they're deep holes, or they're really micro contour problems. And so when you take this beautiful normal skin that's surrounding it and shred it down to try to get down to the abnormal skin that doesn't look healthy, looks atrophic and disastrous, you really have a hard time doing it. I'll tell you, I used to do dermabrasion, mechanical dermabrasion, lasers, full non-ablative, full ablative lasers, fractionated lasers. It's a very hard level to bring that down. And you destroy the skin in the process. Not to mention, you can only really do this in a fair-skinned individual when you're doing maybe an Irish, Swedish person and some Mediterranean and very select Asian and Hispanic. But once you get into the Indian or African population, you really can't achieve that. So what I found that the two main modalities that I have now used to help with acne scarring in a very profound way that is safe in all skin types, and to me, honestly, incredibly safe, is microsilicone injections and mesobotox. So I'm going to briefly articulate this. You can watch my expanded 35-minute video that goes into even greater detail. So the easiest way to think is when there's textural problems, minor pits, asymmetric issues with the skin surface, that's when I use the mesobotox. Now, when we hear Botox, we think temporary, we think paralysis. I've really perfected the art of this. This is permanent. And this is safe, and it's safe if you're a central black African for Irish. It regenerates the collagen. And so I've even had patients, and as I said, the majority of my patients coming in for acne scars have actually had all these lasers. They've damaged the skin. Dermabrasion has ripped the skin apart. The integrity of the skin is actually compromised through these aggressive lasers. Because unlike for wrinkles, they're going super deep with this. And so what my mesobotox does is it doesn't only just fix a scar, but it actually regenerates the tissues of the skin that have been compromised by elevating those disastrous, destroyed tissues from lasers and creating better integrity to that area. It also elevates holes, but not to the level of microsilicone. So to me, they're paired together beautifully. I actually do them at the same day, same time, if possible. Silicone has a bad rap because we think, we Google it and we see, unfortunately, a lot of transgender individuals getting these adulterated silicone in large volumes placed in the butt, or we see these large ones in the lips that scare people to death. I correct silicone almost every week from bad silicone in the lips. But silicone, the reason why it's so amazing is that, first of all, don't put it in the lips and don't use adulterated fake product. I use Silicone 1000, medical grade pure, and from Alcon in Fort Worth. I've been doing it for 20 years. Really an incredible safe profile. And if you want me to cite literature after literature, 10,000 people reviewed, it's there. Go to PubMed. You'll see huge 20-year retrospective reviews. In fact, the guy I trained with had done it for 50 years before he passed on. So why is silicone so much more potent than like Restylane? Restylane creates a Tyndall effect, which means that it creates a bluish color when you're trying to elevate tissues close to the skin. And it really doesn't expand the dermis. So the dermis is that middle layer of skin where it's actually crunched inwards. That dermal area, if you try to fill it with Restylane, it cannot expand. So when I put silicone, I do it slowly over 1 month by 1 month. I can expand that dermal area and actually create a raised elevation. Whereas the Botox takes care of all the damaged skin around it. So you want to elevate areas that are destroyed rather than destroy areas that are normal, because that's how you get balance to the area. Now, if someone has a complete collapsed volume, then I'm using fat grafting. But fat grafting is not great for acne scars. It does not fix the dermal etching. It may regenerate a little tissues, but my Mesobotox does it 100-fold over the stem cells and fat. So these nanofat does not work that well. I've tried it. I've tried different products, different brands, different administrations, and my Mesobotox has crushed it. And it's because I've spent so much time in developing the methodology, and I've actually continued to refine it this year. So think of it this in a summary. Mesobotox is great for the textural issues and also some depth. Silicone is great for depth, and the reason is I can safely expand that dermis without creating lumpiness, migration potential, or Tyndall effect.